Hey folks, Dr. Joe Esposito here. So glad you could be with us today. What we're talking about today, we're going to talk about your house because I've been beating this COVID thing to death almost, and I've covered so many topics. And if you want more information, we've covered it so much on the website, drjoe.com, and we've covered a lot of nutrition. Of course, we talk about food and supplements and things you can do to take care of yourself from a nutritional standpoint, but I also want to talk about your environment today. Because your environment is very important, because even if we're eating a good diet, if we're in a toxic environment or a toxic relationship, that can be very unhealthy for us. We're not going to cover relationships today. We're going to cover the environment. So the things that you're surrounded by, your workplace, your car, your house, your bed sheets, all these things can be toxic or they can be healthy. You have the choice. And so we're going to talk about what options there are for you, because you need to know this. And so we're probably going to brush on nutrition because some reason I just can't get away from that. But these are things you need to consider around your house. First, let's talk about your kitchen, how to make your kitchen healthier. If you have a gas top stove, and I do, and I love cooking with gas, I'm very, very happy with that. Gas top stoves raise the indoor nitrogen dioxide levels. So when gas is burning off, there's a waste product. You probably never thought about your own stove having a waste product. But this chemical can irritate breathing passages, especially with kids. So if you have babies around the house or even small animals, this can be a big issue. Induction cooking works. You can use that if you wanted to. That doesn't put any chemicals, of course, in your air at home. And the smooth surfaces are easy to clean. I do like that. They have now that heat up instantly and shut off instantly, because the old days, the induction took a long time to heat up, long time to shut down. So it's come a long way. I still, I guess I'm old school. I still like cooking with gas. If you do, I want you to make sure that you ventilate. I have really high ceilings in my kitchen, so any of the toxic chemicals go up to the ceiling. Now, if I can, even if it's in the winter, if it's at all possible, I like to open my windows because I cook a lot. And like even last night, I made some split pea soup. I put it in a crock pot, and I put it out on my porch. I have an enclosed porch. And I put the soup out there. But this morning when I wake up, of course, the air will get into my house, and I could smell it. And so I got to remember it's out there, and then I got to take it out of the crock pot and refrigerate it. Really good batch today, too. So I made a split pea soup last night. And I put it outside, which was great. But if I'm using the gas, I try to open the doors, and I've got high ceilings, so I try to ventilate the best I possibly can. Put a fan on if you can. So whenever your oven is gas, whether it's gas or electric, cooking at high temperatures can put harmful fumes into the house. So that smell of food cooking is great, but if you fry things, which you shouldn't, but if you fry things, that can create toxic chemicals into the air. So well-ventilated kitchen is really important. So if you're looking to buy a house, consider that. And that's one of the things I'm concerned with this tiny house craze. It's kind of fading now, but for a while there, everybody was into tiny houses. Not everybody, and if you ever were in some, I remember going to a show one time and in the thing, and boy, I mean, you could literally put your arms out and touch the walls. And I get the concept. You know, less is great. You don't need a whole lot. You need a place to sleep, place to cook, bathroom. It was a great idea, but the problem is that if anything gets into that house, there's not a lot of ventilation. So well-ventilated kitchen, really important. Use your range hood fan, open a window, flip on a ceiling fan, especially if you're cooking at high temperatures, even in your oven, because that can release gases into the air. Personally, I just like opening the windows, and I don't mind it cold. I know some people like it a little warmer than others, but I like it cold, and especially if I'm moving around, I'll even put a floor heater at my feet just to keep it going. If I'm moving around in the kitchen, I'm going to get hot anyway. But ventilation is really important. And that became a big issue way back when we started building high-rises that you couldn't open the windows in, buildings especially. And there was a big movement, and I remember reporting on this, 20 years ago or something like that, sick building syndrome. Because it was so sealed up, and it was hermetically sealed, that you couldn't get fresh air in. So you're recirculating a lot of toxic air, and that became a big issue, and people getting sick just going to work. Now, there's other things in your house that need ventilation. We're going to cover that a little later. Carpets, type of flooring you use, paint. So there's other things, cleaning products, that you got to make sure you have good ventilation anyway. So I am a big fan of opening windows every chance you possibly can. If you use nonstick cookware, this becomes an issue. The coatings on nonstick cookware may contain chemicals that can raise the risk of some types of cancer and thyroid and immune problems. Who would have ever thought? Now, I remember having a story one time with somebody I worked with, I think it was, a long time ago. He had just bought some new birds. He loved exotic birds. He bought some new birds, had them in a kitchen, and he bought some new pots and pans. These were magical pots that don't stick, things slide right off them. And he was cooking in them, and he came back into the kitchen, and the birds were dead. So you may have heard the phrase canary in a coal mine. If you don't know what that means, because some of you may be too young for that, miners used to take birds or canaries in a cage into the coal mine with them. And the birds were much more sensitive to toxic chemicals. So if the bird died in the cage, the miners knew that the air was toxic and they had to get the heck out of there. So that's what happened with my friend, unfortunately. Somebody I worked with, that's right, somebody at the radio station. And yeah, so he was cooking and the birds got, I think they died or they got sick, either way. But it was not a good thing because the high temperatures release harmful substances in the air that then you or your pets or your birds can breathe. And that's not a good thing either. So if you're going to use a nonstick pan, don't use really high heats. You might want to reserve that for a little like a medium type heat. If they have a scratch in them, I want you to throw them away. Don't give them away, throw them away. If they scratch, that means that those little flakes of chemicals are getting into your food. If you're going to use something that's nonstick, and I like cooking, I get it, cast iron works really well. If you've never used cast iron pans, they're different. It's kind of unique. You don't really wash them. You take when you get new ones, and make sure, by the way, you get cast iron made in the United States. If it's made overseas, it can have toxic chemicals in it. So you have to season the pan. And if you don't know what that means, you take some oil, I use coconut oil, and you rub it on the pan, and you put it in the oven about 250 degrees, and you bake it for like a half hour, 45 minutes, and the oil will infuse into the cast iron. And then when you clean it, you just kind of wipe it out and let it dry, because cast iron will rust. If you use soap and water on it, you have to re-season it. And then it becomes naturally nonstick. You can use glass. Glass works really well. I love baking with glass. That's really good. Cast iron, we said, stainless steel is okay. I have stainless steel pots as well. So if you're going to cook something at a high temperature, I don't like those nonstick coatings. Now, they say the new ones are fine and they don't have problems, but they said that about the other ones when they first came out too. And when the other ones came out before that, the other generation before that, they're all fine. And I remember I had a professor one time, he said, it's never a problem until it's a problem, and then it's a problem. And the first time he said it, I thought, that's stupid. And then I broke it down, and I thought, yeah, you could be doing things all along. You could be speeding every time you drive, and you never get caught. Well, it's not a problem until you get caught. Then it's a problem. And so the same thing with a lot of these health issues that we come across with people. You know what, Doc, I've been smoking for years now, and I don't have lung cancer yet. And then suddenly they get sick. They can't figure out where it came from. COVID is there it goes. It came out. COVID's a perfect example. I'm pretty healthy. I eat a bad diet. I have high blood pressure. I'm obese. I have heart disease. It's not that big a deal. Then suddenly something comes along like COVID, and the hospitals are full of people. 94% of people that die of COVID are dying because they have a nutritionally caused comorbidity. So your diet, according to statistics, has a direct effect on 94% of the people dying from COVID. And yet, I don't even watch the news anymore. I gave up on the news because everything was COVID, election, and I just got too stressed out. I had to stop. I've yet to hear anyone, I think once I heard one quick story about vitamin D in England or something like that. Why are we not pushing comorbidities? Comorbidities are the reason people are dying. And then they get to COVID. I'm not making light of this COVID. Please understand that. But I am saying if we address the comorbidities, the chances of you getting dying from COVID or even getting very sick from COVID are extremely low. So we should be addressing the comorbidities and getting to the cause of the problem, not just treating the symptom. Okay, COVID is a big issue. I'm not making light of it, but there are things that you can be doing every single day. And it was interesting. I was on a show, as a matter of fact, last night. I'm a guest on a lot of other shows. And I was a guest on a show last night, and we want to talk about detoxification, how your body detoxifies. And the host, my friend Shelley, bought these juices. He bought 2 gallons of juice that was a detox. And then his co-host, Milani Kai, was making fun of him because he had these juices, and he's going to do this juice, he's going to detox, and then he's drinking coffee, and he's smoking cigarettes, and he's doing a detox. And so we kind of picked on him a lot because that's what we do in our business. We pick on each other. And the point is that he was treating one issue, but then kept throwing bad stuff at it, you know, with coffee and the cigarettes and his bad diet, but he was doing a detox. So they said, when should you do a detox, was the question. And my answer was, every day, every meal, everything you put in your mouth, I want you to consider, is this going to be good for me or is this going to be bad for me? And if it's not good for you, don't put it in your mouth. It's very simple. So when do you detox? Every day, every meal. That's when you detox. Then you don't have to do a big full-blown detox. It's okay to do it. I'm not against it, but I want you to understand that this is a lifestyle. You do it all the time. I don't want you to be a little healthy. I want you to be a lot healthy. I don't want you to be a little pregnant. You're either pregnant or you're not. You're either healthy or you're not. I want you to get healthy all the way across the board. I'm a big fan of water filters. I have a whole house water filter in my house. I think I talked about this maybe even last week. And I've had people come to my house and say, this stuff is amazing. Your water tastes so good. And I said, what does it taste like? They said, nothing. There's the key. It tastes like nothing. And they love that. One of my friends said, I don't drink soda anymore. I just love coming to your house and drinking water. Because I have a whole house water filter. Because in our water, yes, we do a very good job in our society, in our country, filtering water, preventing mass outbreaks of disease, and I think it's great. I want to go to the next level. I remember I knew a gal one time, and she said, moderation is for monks. And moderation is for monks. I don't want you to have moderate health. I want you to have extreme health. And so these are the things I'm giving you. I used to do a lecture. It's called Brown Belt Nutrition. And I said, if you want to do this, it's brown belt. Then if you want to go to black belt nutrition, this is what you do. So today we're talking about black belt health. Well, that's a good idea. I like the title for the show, Black Belt Health. How to get to a higher level. And water filter is one of those things that I think everybody should have. Some water sources have unhealthy chemicals and metals in them. Yes, it's legal. Yes, it's not going to kill you immediately. But again, I want you to get extreme health out of this. So a filtration system reduces a lot of contaminants. Point of entry system is the kind I have. As soon as the water comes in from the street into my house, I've got this water filter. It's about 4 feet tall. It's got several stages in it, and it filters out everything. And not just the water I drink. If I'm taking a shower, one shower, a hot shower, you can absorb as much chlorine as drinking 8 glasses of water. Because when you take a hot shower, your pores open. When the pores open, chlorine can get into your system. Chlorine kills what? Bacteria. We put it in a pool, we put it in a hot tub, kills bacteria. There's a problem. We are mostly bacteria. We have exponentially more bacteria cells in our body than we have human cells. So if you're putting chlorine on your body, in your body, you can be killing off good bacteria as well as bad bacteria. And when it comes to the immune system, about 70 to 80% of your immune system is in your colon. That's where the bacteria, it's called the flora. So if you're drinking chlorinated water, you're killing off the bacteria in your colon. Not a good idea, because that can weaken the immune system. And ultimately, if you keep killing off the bacteria with multiple levels, multiple ways of doing it, you can develop something called a systemic yeast infection. The heck is that? In your colon, you have bacteria and you have yeast, and they live and they hang out and they fight each other for food. And if the bacteria start to die off, the yeasts don't have any competition. So now the yeasts start to multiply. They make little baby yeasts. And eventually that yeast says, I don't like it here in the colon. I want to go somewhere fun. So it can get into your blood system. It's called leaky gut. It can burrow a hole essentially into your small intestine, get into your blood system, and then travel through the body. So it can set up shop in warm, moist places. So where would be some warm, moist places on your body? Your feet, toenails, under your arms, vagina, jock itch, the rectum, scalp. I had a question the other day about dandruff. Dandruff is usually a systemic yeast infection or related to a systemic yeast infection. So if you're doing something as innocent as chlorine, you're doing something as innocent as spraying weed killer, glyphosate. Glyphosate acts as an antibacterial as well and kills off the bacteria. You want to try to avoid that the best you possibly can. If you're showering, you don't want to absorb water, chlorine in the body. Toilet water, tub water, if it's just sitting there, it's releasing chlorine gas into the air. So I prefer, again, if we're going for black belt health, you get a water filter. I use a company called Pure Life Georgia, purelifega.com is their website. I searched around a lot. They have a pretty good product. That's the one I have in my house. If you do order one from them, just tell them I sent you, get a little extra special treatment because they like me. So water filters, I think, are really important, and I think you should have them at least have an under sink one for the water you wash your fruits and vegetables with and the water you drink. There's shower ones. In fact, I have one sitting at I bought one, and then I bought this whole house water filter, so I still have the shower filter. That's another thing you can put up, at least something to filter out the toxins. Now, there's a little pitcher ones. They're okay. They're a step up from tap water. But again, the whole house water filter is going to be your best bet. So they're okay. Anything is better than nothing. Again, I'm not against tap water. I'm saying we're going for black belt health now. The way you store things is really important, especially in your refrigerator or your freezer, the way you store foods. I don't recommend you use plastic unless you're using something that's cold. Like, for example, the other day I made some baked potatoes, of course organic. And they were cool. I didn't eat them all, so they were cooled. And so what I do with them, I had a plastic container. They were already cold. I put them in a plastic container, put it in the refrigerator. No big deal. I made soup yesterday. So the soup was done. It was still warm. I always store it in glass. If I freeze anything, I like to freeze it in glass. Because as it freezes, it expands, and it can scratch any plastic that it's in, and it can release toxic chemicals. These toxic chemicals, like bisphenol A, I haven't talked about BPA in a while. Bisphenol A is a chemical in plastic containers. It can harm the brain of babies and children and raise BPA levels, which can be a hormone disruptor in adults. So, store things in glass. Well, Dr. Joe, I don't want to go out and buy a bunch of glass containers. That's fine. Whenever you buy something in a glass jar, save it. I have a problem. I got to confess to you. It's Confessions with Dr. Joe. If you listen to my Sunday night show, you know what that means. Confessions with Dr. Joe. I save way too many glass jars. And every now and then I have to do a rage, and I go through my pantry and I go, I don't need this, I don't need this, I don't need that, and I throw them out. But if I have a big jar with a big opening, I like it. And I've got a special funnel that even makes the jar even wider. It's used for if you're canning foods. It's just a metal funnel, and it works really well, actually, because then you can put things in your jars. So save your glass jars. When you have too many of them, then you can throw them away. If the lid gets rusty, throw it away, or at least put plastic between, like a plastic wrap. Again, not if it's hot, though. You don't want to do that. So plastic wrap on the top so you don't get the rust in there. So I have a big issue with glass jars. I save them. I grew up really poor, extremely poor. My father was disabled. We grew up in Hoboken, New Jersey, in a little apartment, and we saved everything. There was nothing that went to waste. Plastic bags, if vegetables or something came in a plastic bag, we saved it. Paper bags, we saved. My mother tells the story when she was young, because my grandparents were immigrants from Germany, my mother's parents. They would go to the grocery store, and the paper that they'd wrap like pears in and apples, that little tissue paper and stuff, my grandfather would collect it up, and they'd use it as toilet paper. And I remember my grandparents, they were extremely poor. They were immigrants. They put water in the sink in the bathroom in the morning and washed their hands in it all day. That is not a good idea. That's a very bad idea, actually. But it saved water. And we did everything we possibly could to save money because, again, my father was disabled. We lived on very little income. So saving everything becomes natural to me, and sometimes it's to an extreme. And so I got to somehow, every now and then, take a breath, Plastic storage containers, again, I don't like them. Don't put things in a microwave. I recommend you don't use your microwave. I have a microwave. The only time I ever use it is I put my sponge in there, sometimes at the end of the day, because it kills viruses, germs, and bacteria. That's how toxic the microwave is. And if I have to heat up a hot pack, if I have an injury or something, I have a hot pack I can throw in there and heat it up. That's probably the only time you should ever use a microwave. I am not a fan of microwaves. They change the molecular structure of the food. I've read pros and cons. Yeah, it's fine. No, it's not. I'm not willing to take that chance. I believe that if you're taking something and sending microwave energy into it, it's going to change the molecular structure. So I'm not a fan of that. So if you have a microwave, don't use it. If you do use it, don't. But if you still use it, don't. But if you still use it, glass only. Don't put plastic wrap on top of it. Don't put plastic containers in there. I remember being at the station one day, and a friend of mine was having spaghetti for lunch, and it was in a plastic container. And I said to her, I won't say her name because she's very famous. And I said, she goes, "This okay?" And I said, well, A, you shouldn't be eating that much wheat or pasta anyway for lunch. You should be eating fruits and vegetables. But B, I certainly wouldn't microwave it in a plastic. I'd rather just see you eat it cold than put it in a microwave. And I explained to her the hormone disrupting chemicals like bisphenol A. And she said, oh, I didn't know that. And she ate it cold. So hopefully we taught her a little something there. But don't use microwaves if you can avoid them. Again, what we're talking about today is black belt health. Things that you can do around your house, not necessarily nutritionally, but things you can do around your house to help get you reach a higher level of healthcare. And I'm Dr. Joe Esposito, if you're just joining us, by the way. Cutting boards, boy, they can be a breeding ground for a lot of problems. If you eat meat, which you shouldn't, but if you still eat meat, I recommend you have two separate cutting boards, one for vegetables, one for meat. The one with the meat, I want you to bleach it. A little bit of water, like maybe a tablespoon of bleach in about a gallon of water, not a whole lot. Now here, what am I telling you? Add chlorine to your already chlorinated water because it'll kill bacteria. Wooden cutting board's not a good idea if you're using something like meat. You want to use a non-porous cutting board like glass. Glass is a good idea. Plastic, not a good idea because you scratch it. So I'm not a big fan of plastic cutting boards. Glass would be better than wood. Ceramic would be okay, and I'm not a big fan of plastic. If you can avoid it, please do. If you're going to use wooden cutting boards, just make sure you put it, you clean it, put it in a dishwasher. This way the heat can kill any viruses, germs, or bacteria. But you can really spread a lot of disease with raw meat, which is another reason why you shouldn't be eating meat. Paper towels, probably a better choice over cloth. I like cloth personally, but you got to wash them. Just wash them a lot in hot water. Make sure you I wash almost all my clothes in hot water, except my dress shirts. Everything else I wash in hot water, especially your underwear. If your underwear are touching parts of your body, that may not be the cleanest part, and you want to put it in hot water, and so you can kill any viruses, germs, and bacteria that are on there. So even if it says, wash in cold water, that should be an exception, not the rule, because hot water is going to be a better choice. It'll kill off viruses, germs, bacteria. Your bed sheets, your towels, your rugs, hot water. Underwear, hot water. Because, again, it's just another way you can start spreading disease, and especially now, time of people worried about diseases, nobody really talks about that. So hot water, I use non-scented soaps, clothes soap. The scented ones can have hormone-disrupting chemicals in them, parabens, phthalates, and these are hormone-disrupting chemicals. So there's a lot of natural soaps you can use, folks. I prefer it. I don't like the smell of somebody that smells like clothes soap or smells like dryer sheets. Perfumes, I am not a fan. In fact, I was pumping gas this morning in my car, and the lady a pump away, I don't know how much perfume she had, but holy cow, did she stink. Or stank? She stank? I don't know. I don't know what the right word is there. She stank. And I got in my car. It was in my car. I had to open the windows. And I was like, how much perfume is this person wearing? Perfume is an endocrine disruptor. It messes with your hormones. So what we're talking about today is black belt health, things that are beyond nutrition, things that you can do to keep yourselves healthy. So if you don't know who we are, I'm Dr. Joe Esposito. We have offices in Marietta, Duluth, Stockbridge, and West Cobb. I'm board certified in chiropractic, orthopedics, pain management. I'm double board certified in nutrition, BS in nutrition, retired dietitian, award-winning author. Been in practice 35 years. I've missed a half a day of work in 35 years. Patients travel from all over the world to come see us because we try to get to the cause of their healthcare problems, not just treat the symptoms. So if you have a healthcare problem, back pain, neck pain, shoulder pain, chiropractic is by far the most effective, least expensive treatment for most back pains. So if you want to make an appointment for pain, you can do it right on the website, drjoe.com. If you have other issues, digestive issues, hormone issues, nutritional issues, acid reflux, heartburn, foot pain, whatever it is, go to our website, drjoe.com. In the upper left-hand corner, there's a thing that says services. Hover over that tab and drop down. You'll see all the services we offer. We have chiropractic. We have PRP. PRP is we take your own blood cells, concentrate out the platelets, and inject them back into your body. Wonderful in most cases for arthritis, erectile dysfunction, spotchy hair loss, women with sexual dysfunction, leaky bladder. It's your own cells that stimulate natural growth. So you might want to consider looking at what we have to offer and coming to see us. Normally the first visit is $375. We've reduced that to $199. That includes an exam, x-rays, consultation, first adjustment, going over the x-rays on the next visit, and a nutritional evaluation. The nutritional evaluation alone is $150. And we have supplements on the website as well. We'll talk about that in the next segment. Folks, I'm Dr. Joe Esposito. Got to go to break. drjoe.com. If you have any questions, send it to me through the website or make an appointment. We'll be right back. Hey folks, Dr. Joe Esposito. Welcome back. If you stayed with us, if you're just joining us, glad you could be here. What we're talking about today is black belt health. And I've talked a lot about nutrition in the past, and I will talk about a lot in the future. I'll probably cover it today too. But nutrition is really important because that's something you have control over, what goes in your body. But I also want you to understand that you have control of your environment in many cases too. So the first half of the show, we talked about environmental things that you can do around your house, getting a healthy house. If you're just tuning in, this show will be on our website, drjoe.com. So if you're interested, if you like what you're hearing, we have over 1,500 hours of podcasts on the website. We have audio, video, blogs. So if you're interested in this type of information, drjoe.com, just go into media, and we've got tons of information there. If you like listening to blogs or podcasts, Any podcast service you use, type in Dr. Joe for the health of it. That's the topic of my first book, Eating Right for the Health of It title. But Dr. Joe for the health of it, and you can have your podcast services bring you Dr. Joe 24 hours a day, 7 days a week. So there's tons of information out there. If you have a question, you can always send it to me through the website, drjoe.com. Now, in most cases, if you just search the website, we've done a show or a blog or an article on it, so you can feel free to do that. But if you have a question, a little bot pops up and it says, would you like to chat? And you can send us a question. If we're online, it's me, Garrett, or Joe. If we're online, we'll answer it immediately. If we're not, we will get back to you. Just put in your email address, and we'll get back to you right away as soon as we can with your question. So we want to be your doctors. We want to get you well and keep you well. So if you have a health issue, we want to be the people you turn to. And again, we don't have all the answers, but we usually know the guy who does have the answers. I always say, I know the guy who knows the guy. So we're more than happy to help you in any way we possibly can. Our offices, we offer chiropractic, we offer medical care, we offer PRP, which is regenerative medicine. We offer nutrition evaluations, supplements, digestive issues. So on our website, we have a list of all our services. Laser work, we just added laser to our treatments. It's all on the website, drjoe.com. I don't think laser's up there yet, but Garrett's going to put that up there hopefully soon. So we offer a ton of services, and we want to be your doctors. Well, hopefully we're going to start getting rapid COVID testing as well that we can actually send to you. We're working on that now. I'm checking the efficacy of these companies. But there are tests now that you can actually do and get the results in 10 minutes. So we should have that out pretty soon as well. So I am always on the hunt to trying to find new information for you about healthcare that's going to help get you and your family well and keep you well. So that's why I want to be your doctor. If you want to make an appointment to see us, we'd love that too. And people come from all over the world to see us. We have offices in Marietta, Duluth, Stockbridge, and West Cobb, and you can do that right on the website, drjoe.com. So people come to me all the time, and of course, we get a lot of questions. And people say, Dr. Joe, what should I do for this? And many times I have an answer. But sometimes it's an emergency. And I've had to beat people over the head sometimes because they'll say, well, Dr. Joe, no, I'm going to let you guys fix it. Your doctors are great. I'm going to let you guys fix it. Sometimes you need medical care, absolutely positively. And if that's the case, I've had to argue with patients. No, you need to get to the emergency room now. Maybe we'll take an x-ray of somebody and we'll see they got a dissecting aortic aneurysm. And if it's 55 millimeters or more, that's an immediate emergency. And I've had people come in at 50, 51, 52 millimeters, and it's like, you need to get to a surgeon now. Oh, no, doc, it's fine. I'm just going to change my diet. No. You're past the point of no return here. If you ever watched the Phantom of the Opera, there's a great song, The Point of No Return. And you're past that point of no return. You need to get to emergency care immediately. So there are some things, when the symptoms are serious enough, I don't want you to ignore them. I remember years ago, I was one of my mentors. He said, Joe, don't be a taint nothing doctor. And I said, I don't know what that means. He says, don't say, oh, it tain't nothing, don't worry about it. Ain't nothing. It ain't nothing, don't worry about it. Because if you do, many times that could become a serious issue. Because I'll take x-rays of patients, and we'll put the x-ray up, and I'll say, you've got severe arthritis, you've got degeneration, you've got an old fracture in your spine, you've got severe cord pressure, spinal cord pressure. You need treatment immediately. Well, it ain't nothing, doc, ain't no big deal. I've been like this for years. I understand that, but you need treatment immediately. 99% of the patients get what I'm saying. Every now and then a patient knows more than me because they're much smarter than I am. And they say, well, I'm going to do it this way. Okay, thank you, Frank Sinatra. You can do it your way. That's fine. Did it my way, Sinatra quote. We're both from Hoboken. Sinatra and I have a little connection there. And I fear for them. I'm frightened. A lot of music quotes today. I'm frightened for your children because you might die. And that's a Moody Blues quote. I'm frightened for your children because you have something here that's really serious. And you need to be taking that seriously. And sometimes people don't. And it's like, well, I've learned two things in my life. Don't argue with patients, don't argue with women. Because I've never won an argument either way. But with patients, I'll tell them what they need. 99% of the time, they're on board. Every now and then I get a wise guy. It's like, all right, you'll be back later. Or you may not be back later. Because you'll be dead. So start thinking about it. One of the things you can do is, if you're not sure, always err on the side of caution. So if you have chest pain, or you have pressure that lasts more than a couple of minutes, it might be time to call 911. Now, what other things can cause chest pain? Acid reflux, hiatal hernia. You have a sheet of muscle called the diaphragm, and below your diaphragm sits your stomach. Now, your stomach can push up into your diaphragm, and that can cause chest pain. And I have a lot of people that have had chest pains, go to the emergency room, go to their cardiologist, they get a whole workup, stress test is negative. The heart's in great shape, awesome. Now let's see what else it is. maybe a stomach issue. Let's massage or pull the stomach away from the diaphragm. And in many cases, that helps acid reflux, heartburn, burping, gas, bloating, chest pain. So a lot of times it's stomach out of place. Could be a pinched nerve. From a chiropractic standpoint, you may have a pinched nerve in your mid-back, and that's the nerve supply that wraps around through your ribs into your chest. Could be a misaligned rib in the front of the chest. That could be something we have to address. Could be the sternum out of place. So it could be a physical issue. But if you're having, and we talked about this in the past, women usually have more anxiety, feeling of doom. Men usually have shooting pain down their left arm and chest pain, like an elephant is sitting on their chest, can be a bad one. Don't drive yourself to the hospital. Get somebody to drive you, call an ambulance, get there as quickly as possible, because the ambulance, of course, they're trained professionals, and you may need CPR, you may need an injection. So, you don't want to jerk around with chest pain. It's not something you want to, fiddle with. Now, if you have your test done and the doctor says it's negative, then you need to come see us, because it's usually either a heart attack, which is very rare, but not uncommon. But many times it's a stomach out of place, it's a rib out of place, it's a bone in the spine out of place, and that's more of a chiropractic issue. So we are here for you, and we get patients all the time. They've exhausted everything else. They've gone to their doctors, they've had their blood work done, they've had their MRIs, they've had their CAT scans, and maybe not just chest pain, but a lot of problems. There's nothing else we can do for you. Then they come see us, and it is a pinched nerve, it is a stomach issue, it's a digestive issue, maybe it's a nutritional issue. And we fix it, and they say, why didn't I do this sooner? Why did I wait so long? And I, for the life of me, don't understand why, if somebody has back pain, they're not going to a chiropractor first. Chiropractic is the most effective, least expensive treatment for back pain. Now, when is it not a chiropractic case? Well, shooting pain down your left arm and an elephant sitting on your chest. Now, shooting pain down your arm could be a pinched nerve too. Loss of bowel and bladder control. That could be a ruptured disc. It's a medical case right away. Pain so severe that you're passing out. It's a medical case. But after we get that under control, we're here for you. So we want to be your portal of entry. If you're not a case for us, we always send you out for treatment and then come back to us later on once the life-threatening situation is stabilized. So these are things, what we're talking about now is symptoms you should never ignore. Shortness of breath. If it happens suddenly and keeps you up, keeps you from your daily activities, it might be an issue. Now, sometimes it's asthma, and it could be chemically induced asthma. You're allergic to dogs or cats or wheat or dairy. Those are the two big food allergens. Could be a pinched nerve. I've seen many asthmatics with a pinched nerve in their neck, and they can't breathe because that's the nerve supply, lower part of the neck, that's the nerve supply into the lungs. We go in and adjust them from a chiropractic standpoint, and they're able to breathe suddenly. That's pretty cool because I've seen that happen a lot in my career. It could be the stomach pushing up against a diaphragm, so your diaphragm can't drop down, you can't get air into your lungs, and then you can't breathe. So there's a lot of different issues. You could be having a heart attack or a pulmonary embolism, which is a blood clot in the lungs. So again, depending on the severity, it might be something you don't want to ignore. You might want to get medical health right away. If suddenly you lose your vision, if suddenly happens quickly, your vision becomes blurry. A couple of years ago, I remember, I started seeing flashing lights out of the corner of my eye. And I remember there was a child in the back seat of my car, and I said, why are you flashing the light? Why are you playing with flashlights? She goes, I'm not. I thought, okay. So it kept up, went to my eye doctor, and she said, as you get older, there's issues where the retina can actually become a little detached. And she said, it's nothing to worry about, let's monitor it, and within a day or so it was gone. But what did I do? I went right to the eye doctor. I want to make sure this is nothing serious, and it wasn't. It was no big deal. So if you get dizzy, numbness, vomiting, confusion, trouble talking, these could be signs of a stroke, could be signs of a visual issue, a brain issue, a brain embolism or aneurysm. So you don't want to play around with that. And once again, I even called my doctor on a Sunday, and she said, well, I was just about to go out. I was going hiking or something like that. She goes, I'll meet you at my office. She showed up at the office in her hiking clothes. She checked me out. She said, you're fine. It cost me a little more money, but you know what? It was worth it. Because what if it was something more serious? Wasn't, but if it was, I would have wanted to get there, because the quicker you get to something like a stroke or an aneurysm, the better chance you have of survival. So again, I can't fix everything, but I can fix most things. And we have a protocol for just about everything, but sometimes it's a little outside of that range. If you burn yourself, you might want to get to the emergency room if it's a large part of your hands or your feet, your face, your groin, your knees, your elbows. If it's a real bad burn, and that would be what we call a level 3 burn, a third degree burn, Bigger than 3 inches, if it's charred, if you don't feel pain. Okay, I burn myself, it hurts. I burn myself so bad I don't feel anything, and yet the skin is all charred and it's white and it's blistering. That's a 3rd-degree burn. What did I do? I burned the nerves. That may need medical treatment, and you don't want to jerk around with that because you can get scar tissue, and scar tissue could really be limiting, not only just aesthetically, but it can also limit function. And scar tissue, we have flows of energy through the body. You don't want to interrupt the flows of energy. With chiropractic care sometimes, the bone is out of place. Not only does it pinch the nerve and cause pain, but it affects something called the chi, the flow of energy through the body. And this is from Oriental medicine. And so scar tissue can block chi, and sometimes we have to go in there, and we have special adjusting tools we can break up scar tissue with. Works really well. We have a laser. We could laser scar tissue out sometimes. It doesn't hurt. You don't feel anything with the laser. But there's a lot of different treatments you might want to do, and that's why with burns, you don't want to joke around. If you start vomiting, all of a sudden, you don't know why. If you vomit and it looks like coffee grounds, okay, that's very serious. That could be cancer. So if you're vomiting and you don't know why you're vomiting, now, yeah, you drank too much booze, you throw up the next day, not that big a deal. Maybe you got some food poisoning, not that big a deal. But if it's continuous vomiting, you start losing consciousness, you start getting dizzy, this is something you might want to consider dealing with it right away. Traumatic brain injuries. We deal with a lot of traumatic brain injuries in our offices. How do you get them? Sports? Question for you. I'll answer it for you because this isn't, you have no way to talk to me now. Football. You've seen football. What position do you think has the most traumatic brain injuries? A quarterback gets tackled a lot. If you're a receiver, you get hit. While you're running, you get hit. The linemen get the most traumatic brain injuries because every play, they're usually butting heads, or they're ramming their head into something, or you're thrown to the ground. Of course, I played line. I played offensive and defensive tackle and center when I played football, and a lot of traumatic brain injuries. And so with that, chiropractic care works real well, but then we have neurologists we work with, or neurosurgeons, but also we have a laser treatment. We can do laser for traumatic brain injuries, and the laser can actually penetrate in through the skull and activate what's called the mitochondria in the cells, and the mitochondria produce energy, and in many cases it revitalizes function of the body. So traumatic brain injuries, you definitely want to come see us for that. Sometimes we have to refer out to a neurologist or a neurosurgeon, but then we co-manage the case. So the doctors I work with, we always co-manage the case. So you do your medical stuff, and we have a medical doctor as well, but he's more regenerative medicine. So arthritis, non-surgical facials, hair replacement, we use something called PRP for that. So it's regenerative medicine to keep the body young and healthy, and then sometimes we have to go outside that. Now, even with PRP, it's your platelet-rich plasma. It's your own cells from your own blood concentrated down. We put it in a centrifuge, and we can inject those cells back into your body, and it stimulates new growth. And it can be used everything for erectile dysfunction, way less expensive than most treatments and very effective in most cases. If women have sexual dysfunction, if they have bladder leakage, you can put the stem cells back in there. Well, it's called an O shot or a P shot. My doctor is certified in O and P shots, it's called. Hair replacement, again, you're totally bald, it probably isn't going to work, but if you have, male pattern baldness, many times it works great. But arthritis, knee arthritis, shoulder arthritis, spinal arthritis, folks, it's your own cells. It's relatively inexpensive for what you're getting, and it's something I'd recommend you consider before you do anything else. And you can always set up a consultation with us if you want to. But we're talking about time to call the emergency room, time to when you don't want to ignore these symptoms. And I got off on a tangent there. Cuts. If you see yellow fatty tissue underneath, you should get to the emergency room. If you will need quick attention sometimes, if it's on the face, the neck, the genitals, across a joint, that's you need medical care. I've told a story a while ago. I was in my yard, and it's the same injury, by the way. Somebody said, "Oh, you hurt your finger again?" I said, No, it's the same injury. I was trying to move a big boulder. I was planting some trees in my backyard to create a natural barrier between my neighbors, and the pick slipped, and my finger got crushed. And I pulled my glove off, and a whole tip of the finger peeled back, and I saw the bone underneath it. Oh, my gosh. So I washed it off. I went to a walk-in clinic, and the doctor said it's a perfectly clean cut. You washed it out. You did everything you were supposed to. You got here right away. We can stitch it or not. What do you prefer? I said, I prefer not to stitch it. They said, okay. And it healed fine, and it's 99% of what it was before. So with deep cuts, that's not something you want to jerk around with. If it's really deep, you see bone underneath it. If you start seeing fatty tissue underneath it, go get that checked because you can get an infection or worse. So that's not something you want to play around with. So again, there are times when coming to see us is definitely the protocol. If you have neck pain, back pain, shoulder pain, headaches, numbness, tingling, radiating pain, probably come see us first. We have offices in Marietta, Duluth, Stockbridge, and West Cobb. Even Saturdays, we're even open in Marietta office, so we have 6 days a week we can service you. So come see us for those issues. The issues we're talking about today, we might want to consider an emergency room visit or medical evaluation, and then when you're done, come see us and we'll work on getting you well. If you have nutritional concerns, okay, I'm double board certified in nutrition and a BS in nutrition. I'm a retired dietitian. I write books about it. I've been studying biochemistry, neurophysiology, and nutrition for 40 years now. We want to be your doctors. My team of doctors now. Of course, I don't see all the patients, but we want to be your doctors. So if you're serious about wanting to get well, go to our website, drjoe.com, make an appointment. We can get you in pretty quickly. The first visit is normally $375. That's an exam, x-rays, consultation, first adjustment, and going over the x-rays and the nutritional evaluation on a second visit, and we've reduced that to $199. We do accept insurance for treatment after that. We accept almost all insurances, car accidents, sports injuries, Medicare. Yes, a few doctors that still take Medicare. If you've ever been in a car accident, I say this all the time, and patients come in every day when they hear me say it. If the car was damaged, you were damaged. I saw a patient yesterday, as a matter of fact, and he said, Doc, I was in an accident a year and a half ago, and I'm still having problems. And I heard you say if the car was damaged, you were damaged. But he says, I went to my medical doctor, and they did an evaluation. They said, there's nothing else we can do. Go home. He says, I've been suffering for over a year now. He says, and the car was damaged. He said, so can I see you now? I said, yes. It doesn't matter how long ago the accident is. But if the accident is right away, you come see us, the chances are, A, we'll get better results, and B, when you're dealing with insurance companies, they can be, I won't say the word, they'll say, well, you didn't go to the doctor like that day. I literally had a patient the other day. The accident was on a Friday night. She came to see me Monday. Insurance company said, well, you didn't get to the doctor fast enough. She said, it was Friday night, Saturday morning. I couldn't get to a doctor. Everything was closed. And so that's like their canned answer, their cheesy answer of saying, well, you weren't hurt if you didn't go to a doctor. So we had to write up a letter, and we got it approved, and it was okay. But the quicker you get to us, the better you're going to be. And everybody in the car needs to get evaluated. So if there's nothing wrong, we'll say, hey, there's nothing wrong. We had one evaluation, go home. But if there is something wrong, you definitely want to get that fixed. So if you do want to make an appointment, we would love to be your doctors. drjoe.com, you can book it right online. There's phone numbers on the website if you want to call us. But each office has its own calendar. Click on the calendar, set up an appointment. We'll call you like the next day or the day after to discuss it. Give you all the information, make sure the time's available. So we want to be there for you. So stop suffering needlessly. Biggest complaint I get is, why didn't I do this sooner? Supplement-wise, the minimum supplements you should be taking would be Dr. Joe's Super Greens and Dr. Joe's Essential Source. They're 2 powders. They taste great. One of my coworkers at the radio station, Milani Kai, we were talking on the air the other day, and she said, I've tried these green powders and stuff. They tasted awful. She goes, I like yours. She goes, I had to stop taking it. I said, I want to take more. She goes, they taste so good. So I like the mint-flavored Super Greens, by the way. There's plain and there's mint. It's a little sweeter than mint. The plain is a little plainer. So whatever you like. If you like it sweeter, you like it less sweet, we have 2 options for you with the Super Greens. So we want to be available to you. The supplements you can pick up in our offices, or we'll deliver them for you. I do strongly advise that, especially now in the environment that we're in, you also take vitamin D. Vitamin D3, not vitamin D2, that's synthetic, vitamin D3, and I recommend about 5,000 international units a day. That's 5 drops. I always say vitamin D is the cheapest insurance policy you'll ever buy. So I take Super Green Essential Source, and vitamin D would be the starter kit, if you want to call it that. But on the website, we explain each supplement. We have about 20 supplements now. We explain each one, what they're for. If you have questions, you can always call us. But we can deliver the supplements. You can pick them up if you want to at our offices, save shipping. But I'm begging you, folks, please get on a supplementation. I don't think anyone doesn't need supplements. I think we all do. And ours are really good. A lot of them are raw, so the enzymes are still active. So I feel it's certainly no harm in erring on the side of caution. But I tell you what, most patients, when they take supplements, love it. So you want to make an appointment, get the supplements, more information, drjoe.com. Under the services tab on the top of the website, it has a list of all the services that we have to offer. We want to be your doctor, so stop suffering needlessly. All right, a couple more things. Almost out of time here. Don't ignore these symptoms. Men, if you have testicular pain or swelling, get that checked. You could be cutting off a blood supply. There's a lot of blood supply in the testicle area. If you start having severe pain down there, get to the doctor. Women, severe shooting pain in the ovaries. Sometimes there's a cyst on the ovary and it could burst, and sometimes it's benign. It bursts and it's fine. I had a friend of mine have that happen when I first met her, actually, and she had real severe pain. She went. I said, go to the doctor. She went, and it was a little cyst that burst, and it was done. So it depends on how bad the issue is, but for men especially, with those blood vessels down there, it can get twisted, and torsion can come in, and it causes some real serious issue. Fever, of course, I think everybody's aware that fever is not something you want to play around with. If you have a fever above 104 degrees, you definitely want to do something about that. Try to bring the fever down if you can. One thing you could use is just isopropyl alcohol. Take a rag, put some rubbing alcohol on it, put it on your head, it cools it off, and it draws the heat out. Fever is good to a point. Pain is good to a point. So fever can be good because it raises the body's temperature, and that can kill off viruses. So that's why, now we're saying 101.4. Anything above that, you definitely want to isolate now because of the environment that we're in. But you can get tests again. Hopefully we'll have these tests pretty soon. And for a baby, 100.4, not a bad idea to get that checked. But for adults, a little bit of fever, it's probably not that big a deal. The body's doing exactly what it's supposed to do. But if it starts getting too high, if you start getting delirious, if you start seeing things, hearing voices, definitely, you may not know you're doing this, but if you have somebody in your life, get them to the doctor right away. Confusion or trouble speaking, that could be a sign of a stroke. Okay, tests we do in the office: puff up your cheeks, whistle, stick your tongue out to one side and then the other, blink your eyes. That's one sign of stroke. The body isn't working properly. It could be a brain issue, and the quicker we get to a stroke patient, the quicker we get good results with it. And we have a lot of treatments we can do with stroke patients: rehab, chiropractic neurology, functional neurology, laser therapy. So there's a lot of different things we can do for people with stroke patients to try to get the body to heal. Because the brain, when I went to school, I was taught that the brain, once a cell is dead, it's dead. It's not true. The brain has this ability called plasticity. And plasticity, it's like plastic. It can reshape and remold itself. So in many cases, when there's brain injury, the body can heal itself and remodel itself, which is kind of cool. And of course, you have broken bone. Don't jerk around with that. Get to the doctor right away. I've broken many bones in my life, and every time I went to the doctor, and every time I was glad I did. So folks, I'm running out of time. If you have any questions, go to our website, drjoe.com, drjoe.com. You can send us questions through the website. Follow us on Facebook and Instagram at Dr. Joe Esposito. Please follow us on Facebook and Instagram. That's your homework assignment, because the more followers we have, the bigger influence we have over people. If you do want to make an appointment, drjoe.com. First visit is normally $375. We've reduced that to $199. We do accept insurance for treatment after that. We have x-rays in several of our offices. We can take x-rays right on site. We want to be your doctor. And if you're a VA patient, if the VA refers you, from what I understand, the VA is going to cover your bills too. So drjoe.com. If you have any questions, our website is available 24 hours a day. Thanks for tuning in. We'll catch you next time.